Hello, my name is Avery Hidalgo, and for my Health Science 427 project, I chose to focus on Vicodin. So for those of you that don't know what Vicodin is, it's a mix between acetaminophen and hydrocodone. Acetaminophen is a less effective pain reliever, things such as Tylenol, and hydrocodone is an opioid pain reliever, which is often prescribed, are also known as narcotics. We're going to go over a little bit about narcotics. They're also known as opioids. They're natural occurring substances that are derived from poppy, which is the opium, and synthetic substances. So in our case, our opium would be the hydrocodone and the synthetic substance would be acetaminophen. Vicodin is also one of the most common narcotics used in the U.S. The reason Vicodin is abused is because of the prescriptions. Nearly 136 million prescriptions of opioid medications was dispersed, with Vicodin being one of the most common. Also, of all the prescriptions containing hydrocodone, which is a part of Vicodin, the most frequently prescribed are those that combine with acetaminophen, which brand names are Vicodin or Lortab. In a survey done in 2013, it showed that 24.4 million people by the age of 12 or under in the United States use hydrocodone recreationally at some point. This is crazy because, to think about it, people starting at the age of 12 to be using such a drug recreationally is scary because of how addictive it is, and it's not supposed to be used for fun. It's supposed to be used to help people relieve pain, but after that, it should not be prescribed again. A big reason for this abuse is because Vicodin and Lortab and other generic brands are affordable and cheap. These generic brands are safe, they're effective, they have the same ingredients, and they work the same way. So why spend money on super expensive things to get that feeling that they get from those mix of acetaminophen and hydrocodone when they can spend very little money? Now, with dangers of Vicodin. For college students, obviously you're always dealing with peer pressure, but peer pressure to use such drugs deal with social, physical, and emotional issues leading to academic problems such as anxiousness, dizziness, drowsy, or sleepy, blurred vision, which makes it hard to focus on school. Also, on college campuses, consumption of alcohol is very high, which consumption of alcohol and Vicodin at the same time causes for your central nervous system to become fully suppressed, which slows your breathing, which is not safe. And the reason for this is because alcohol and Vicodin have the same effect on your body. Now, it can also be used as a way to reduce pain because you don't want to think about that pain that's in your foot while you're trying to study for a midterm exam. And according to SAMHSA, 1 in 4 college students have used prescription drugs illegally, which means that these students are getting drugs from people who are prescribed and using drugs that they shouldn't be, that aren't prescribed for them. And overdose is often common because people don't pay attention to how much they're taking. They just want the pain to go away, and that leads to a lot of accidental deaths within college. Now, for everyone, the dangers, obviously, because it is one of the most commonly abused painkillers, it's due to the prescription. So be careful when you're prescribed Vicodin, and make sure that you're talking to your doctor as well about how you're feeling on Vicodin, that you don't feel like you're going through withdrawal symptoms or being addicted after a few uses due to surgery or whatever. And then make sure that you're aware that your pain, you feel that you can fix with other medicines, that it's not as though your pain does not go away unless you use something as strong as Vicodin. Now, there are conditions that prescribe Vicodin, one being toothaches, because there is a lot of pain, back pain a lot because people need to go through the day and sometimes back pain is not tolerable, post-surgical procedures, if you've had something serious done, and chronic pain all over so that you're able to go through your daily life. Now, if you're worried about addiction, there are signs to know for others. If you notice that their body adapts to pain relief given from small dosages of Vicodin, that the small dosage was once recommended, they no longer feel as though their pain is being fixed. You can also look to see if they're beginning to take a higher dose to relieve the pain, and if they are taking a higher dose, that's an immediate sign that the person is becoming dependent or addicted. Now, if you're worried about addiction for yourself, just pay attention, like the other ones, that if your pain is only relieved with a high dose, you're starting to take excessive amounts when you feel you need it, even if you don't. You're beginning to use for recreational purposes. That is a big red flag. Or mixing with alcohol to see how it feels. You're asking for more prescriptions, or you're adding it to another prescription. You're constantly buying from someone who has this prescription, or you're faking an injury to get a prescription refilled. Withdrawal is common. It begins within 36 hours of cutting it. The peak time is 2 to 3 days, but it usually goes away after 2 weeks. Just pay attention for cold shakes, chills and sweating, insomnia, diarrhea, things like that. There's treatment offered. You always ask for help. There's always people who are willing to help. You can meet with a doctor. There's time for detox, such as rehab, or go to intensive therapy to talk to people. Thank you so much. This is our reference.